You can achieve minimal residual disease-free status with chemoimmunotherapy. There's a drug that's in development now called Navitoclax, which is an oral small molecule inhibitor of BCL2. Good quality deep remissions have been demonstrated with this oral agent in clinical trial. And that's in contrast to some of the other small molecule inhibitors where we get excellent long-term disease control, but we don't get good deep remissions. We get partial remissions in most of the patients. So in terms of the small molecule inhibitors and what's happening in the future, discussions about minimal residual disease-free status are most relevant now in terms of venetoclax-based strategies. They probably will become more relevant with the BTK inhibitors and PI3 kinase inhibitors as we get deeper remissions with combinations. What our data with chemoimmunotherapy has demonstrated is that we can get a good number of patients into complete remission, and we can demonstrate in those patients who get a good complete remission, there's a significant proportion of them who achieve minimal residual disease-free status in the bone marrow when we evaluate by 4-color flow cytometry. Now, if a patient achieves a good remission, MRD negative with chemoimmunotherapy, that clearly correlates with longer remission duration and longer overall survival. And in our experience with the FCR regimen, we can demonstrate that there are patients with mutated immunoglobulin heavy chain variable gene with the FCR treatment who have more than 10 years progression-free survival. And maybe some of those patients are cured. And it's likely that the patients who achieve MRD negative complete remission at the end of FCR, who are among the patients with mutated V gene, who are the patients who account for those that are potentially cured with FCR. So much of our work and our clinical trials now in terms of new treatment development are taking patients who are chemoimmunotherapy eligible and identifying their V gene mutation status and developing new chemoimmunotherapy regimens for the patients with a mutated V gene as a strategy to get a higher number of those patients in a good MRD negative complete remission and at the same time combining new agents and trying to reduce the exposure to chemotherapy.